First of all, it's important to understand that every woman's periods are different. If you consider periods heavy for yourself, it may be completely normal for another woman. Generally, by and by, periods are considered heavy if they interfere with your daily life, i.e., if they stop you from going to work or school or just normal day-to-day activity. Now, I always tell my patients that a good indication that the periods are heavy if you're having to change your pads every hour or so. Sometimes you are flooding or passing clots, and a good indication of heavy bleeding is the size of the clot. So if you could see a 10p coin or a 50p coin, if you are passing clots these sizes, this is an indication of you have to seek help and your periods are heavy. If you're bleeding, as a third point would be if you're bleeding through your clothes or your bedding, your periods are heavy. Or lastly, if you're using two different types of sanitary products, tampons and sanitary pads at the same time as well. For many women, there could be absolutely no cause for heavy periods, and we used to cause it dysfunctional dysfunctional uterine bleeding. However, there are some conditions of the womb and the ovaries that can cause heavy periods. One of the most common causes could be thickening of the lining of the womb. They are called polyps, completely benign growth of the non-cancer or benign growth of the fibroids. Again, they are non-cancerous growth of the uterus that can develop in and around the womb, causing heavy bleeding. Now, there is another long list, and some of the conditions that can cause heavy periods with or without pain could be endometriosis, adenomyosis, pelvic inflammatory diseases, bleeding disorders, or endocrine conditions such as thyroid dysfunction. So like I alluded to as to when the list of heavy bleeding, the way you should define heavy bleeding, it is important to see your GP or your gynecologist if for around 3 months or so, you've been having your periods longer than usual, more pain than usual, or you're passing clots or flooding. If you're feeling particularly tired or exhausted, it's also important to seek help. Now, this is not a part of heavy bleeding, but I think it's important to include this. If you notice irregular bleeding, particularly in between your periods, or after sexual intercourse, it's important to seek help with your doctor or your GP. If you're over 40, if you're over 40, it is especially important to seek advice, because this could be a cause. This can be caused by precancer or cancerous growth if your bleeding is erratic. So when you come to see us or your gynecologist, initially we'll talk to you, we'll take a detailed history. It will be your personal history, it will be your family history if there's anything in the family causing heavy bleeding. In some cases, we need to do an examination, and then we'll move on to investigations. And that could be a blood test to rule out anemia, an ultrasound scan, and that will be a transvaginal ultrasound scan to check for polyps. They are the thickenings of the lining of the womb, or the fibroids, that are the non-cancerous growth of the womb. Occasionally, we need to rule out infection, so we take internal swabs in the vagina. We often do sampling of the endometrium or the lining of the womb, where we pass a little tube into the lining of the womb and take a sample, send it to the lab to see what type of growth there is. And lastly, we may decide to do a telescopic procedure called as a hysteroscopy to understand how the internal health of the uterus is. I think, like anything else, it would be important to have a healthy lifestyle, eating fiber-rich diet, increase green leafy vegetables that are rich in iron would certainly help. So the treatment is important, and it's divided into medical treatment and surgical treatment. So I would give you a short summary of this. Medical treatment can be a non-hormonal treatment or a hormonal treatment. The non-hormonal treatment could be something really simple as taking mefenamic acid, which is a tablet similar to Nurofen, a non-steroidal medication just for reduce the pain. And one of the effects it has that it reduces the flow of the periods as well. The other non-hormonal medication is tranexamic acid, and what it does is it contracts the blood vessels, i.e., makes the blood more clotty, so that the flow of your periods is reduced. Within the medical treatment, the hormonal form is just a normal contraceptive pill that will suit you, that you've taken before, may or not, or we could help you choose from the combined contraceptive pill or the progesterone only contraceptive pill. Under the hormonal treatment, one of the hormonal coil is gaining a lot of significance, and it's called either a Mirena coil or a Kyleena coil. And what it does is, within the coil, there is a small amount of progesterone hormone. And what it does is it secretes the progesterone, it releases the progesterone hormone in a very low quantity around the womb where it's actually needed. And over a few months, it thins the lining of the womb and causing you not to have pain or bleeding. So this is again considered an extremely good option for women who have just heavy bleeding, but not considering to fall pregnant in near future. Lastly, the surgical option is, as we discussed before, if you have a polyp, removing of the polyp would treat the heavy bleeding. We could do a procedure with the hysteroscope and remove the lining of the womb with radio frequency. It is called the endometrial ablation. And then there are the variety of other surgical options available depending on what we find when we actually investigate you. And that would be removal of the fibroids causing called myomectomy, uterine artery embolization to shrink the fibroids itself. And lastly, in extreme circumstances, removing the uterus itself. And that would be the hysterectomy.